So let's talk about the post-operative instructions, okay? So I don't like taking out sutures. So rarely I have to cut out sutures, but most of you are gonna get 3 layers of tissue brought together with absorbable sutures that last 3 to 6 months to support wound healing. And then when I'm done with your surgery, I'm gonna put tape or glue or both on your incisions. Then what I do is, like for example, if it's the breast, I put an ABD pad, which is like a big maxi pad, or for the tummy, I put it over the incisions to kind of cushion things right away and also absorb any fluid that might seep out. And then if I always wrap the breast first, so I'll wrap you in an ACE bandage. ACE bandages are ugly, they itch, but one size fits all. And I don't want you pulling the ACE bandage real tight, and because it's not an ankle sprain. It's supposed to feel like a camisole, okay? It's not supposed to be super tight or super loose. At most, it's supposed to feel like a sock over your foot. And I'm gonna wrap you, and when I wrap you, I want it to go from the top, from the top, like this is my armpit. It's supposed to go from the top of your shoulder, of your breast, right underneath your shoulder, right into the top of your armpit, all the way down to the bottom. So sometimes I use 2 or 3 ACE bandages to go from the top to the bottom, but keep it loose. Not so loose that when you cough it falls down, but not so tight that it's killing the tissue, okay? You should always be able to comfortably put 2 fingers underneath without it being a problem or feeling too tight, okay? So I'll wrap the breast, and then if you have belly surgery, then I'm gonna put an abdominal binder on, okay? The binder is not meant to be too tight. The reason why it's important to wrap your breasts first is because, let's say this is your binder. If the binder, when you sit up, if it digs into your breast, it could cause, this area may be numb, right? And it could dig a hole into it and cause the skin to die or rip a hole open. So I want it to be padded. So that's why you're gonna wrap in an ACE bandage first, then you're gonna put your binder on. And when you shower or you're taking the stuff off, take your binder off. Then, if you had belly surgery, and then you're gonna take your ACE bandage off, okay? Now, the first day after surgery, you're gonna wanna take a look. So unwrap your ACE bandage, unwrap it and start re-rolling it so that you can put it on the counter, wrapped like in a cigar. Throw away the big white pads, take a look. It's normal if one side's a little higher, one side sticks out a little bit more. Just as long as one doesn't look like a watermelon and the other side doesn't look like a cantaloupe, as long as they're the same fruit, you're okay. Then have somebody re-wrap you. If it's hard for you to re-wrap because you don't have help, then use the sports bra that we gave you or a loose fitting bra, okay? When you wear bras, very important, make sure that they don't leave marks on your skin. Make sure they're not too tight. If you have a post-operative garment for a Brazilian butt lift, make sure when you put it on, it's not too tight. It's supposed to be tight, but you want to make sure when you're putting your skin into it, you're not folding the skin, right? If you fold the skin, you're going to kill the skin where it folds, okay? So it should be smooth. Also, very important, if you have drains, you never want to have the drain going under the garment and being squeezed. The drains always have to be coming out of the skin or underneath, if you have drains coming out of your groin area, the drains shouldn't be under the bandages. They should be coming out, and then you should be pinning them to your clothes, okay? So I'm gonna call you from my cell phone after surgery because people don't remember everything I say. But that doesn't mean you don't do your homework. Read everything line for line, write down questions. You can ask me the day of surgery or you can call the office before. But I want you to read everything. This is a general overview. But anyhow, I'm going to call you the night of surgery. I'm going to check on you for the first couple of days. Make sure you're doing well. You'll be able to text me or call me. My cell phone is not a chat line, okay? I'm a really busy guy. I have lots of patients. But I want to make sure you're not worrying about things unnecessarily. So if you call me and I say, hey, it's fine, then that means it's fine, okay? I don't need you to Google or ask 100 other people, okay? If you feel like something's getting worse or it's changing, then please let me know, okay? But please be respectful of my time and understand that I'm giving my phone out because I don't want you to have emergencies without me knowing about it, okay? Anyhow, so positioning, after surgery, if you only had your breast done, you're gonna sleep on your back because you're not gonna want to smash your new breast implant that you got, so you're gonna sleep on your back. Now, whether you're flat on your back or you're on an incline, I don't care, as long as you're not sleeping on your breast. After 2 weeks, you can sleep on your side. After a month, You can sleep however you want, on your abdomen or whatever. If you had a tummy tuck though, that trumps everything. So if you had a tummy tuck, I need you to because remember I pull my tummy tucks really tight, you're gonna walk everywhere like in this kind of hunched over position, right? You're bent at the waist, you're bent at the knees, and you're walking like this. But also when you're sleeping, you're gonna be kind of like in this like beach chair position, right? You're bent here and here. Because if you go straight up, you're gonna rip this open, okay? And I don't want that to happen. So I want you to always be in a beach chair position if you had a tummy tuck for 2 weeks. When you're sleeping and when you're walking, you gotta be hunched over. Hunched over isn't you move your neck. It's gotta be your waist has to be down, okay? And also, if you don't have like a reclining bed, we have a medical supply store that will let you rent a medical bed that does reclining the way I need it done for about $300 a month. Like they drop it off at your house, it's already cleaned, and then they come pick it up, okay? And I would definitely get one of those if you're getting a tummy tuck, okay? If you're just getting a breast aug, you don't need that. You can just put a couple pillows under your back. What else? I'm just gonna go through this stuff. So leave all the tape and the glue intact. That means if you see tape on your incision, don't peel it off, okay? Those are steri strips designed to keep, designed to keep your incisions together, okay? Now, when you shower, just like you wash your hands with soap and water, you can wash all this, your incisions, everything with soap and water, okay? Rinse off, pat dry, then put your ace bandage or your bra on, and then your abdominal binder if you got belly work done, okay? So that's all pretty self-explanatory. Speaking of showering, you can shower 2 days after surgery, but I don't want you to submerge or sit in a tub of water. I don't want you to be in a tub of water, ocean, pool, jacuzzi, river, hot tub for a month after surgery, because the pressure from the tub can push water into your incisions, whereas a shower head is not strong enough to do that, okay? So anyways, you're gonna always have your ace bandage or your bra or your binder on, except for when you're showering, okay, for 3 months, okay? We'll talk more about that when I see you in person. Now, working out. Do not work out, don't go on hikes or hard walks and stuff like that for a month, okay? If I clear you to do it sooner, fine. But a month is like very, very, very liberal, okay? A lot of people say 3 months, okay? But my protocol, because I deal with a lot of models and athletes and fitness champions, bodybuilders, a month is really pushing it, okay? So plan on not working out for a month. Don't push or pull anything over 10 pounds for a month. If you had a tummy tuck, you also can't push or pull anything over 25 pounds for a second month. And if you had a tummy tuck, don't do any sit-ups for 6 months. All right, now those of you that have kids, because most of my clients are single moms, they have no help, try to get someone to help you pick up your kids and stuff for 2 weeks. They can lay on your stomach or whatever. They can be on your shoulder, but you can't be throwing them in the air and catching them. But after 2 weeks, you can pick up your kids for just to put them in the crib or in the car, but try to limit it to 4 times a day, okay? So that's that. Now, if you get a tummy tuck, most likely you'll have drains. If you have complex breast surgery, you'll have drains sometimes. So anyhow, the drains, they're sticking out of the body. Try not to just let them hang to the floor because they'll get ripped out and then you have to go to the hospital. So what you do is you want to pin them coming out of your, outside of your garments and clothes. You want to make sure your ace bandage or your bra is not compressing the tubes, but you want to have it coming out, okay? If my drain comes out where my finger is, my bra or ace bandage should be above that. It shouldn't be compressing it, okay? It should be above that. So have them coming out and then pin them to your clothes. Make sure they have slack. Now for when you want to shower, get some old Mardi Gras beads or a thick necklace or something. pin them to the necklace so your hands are free. Also, if you had a tummy tuck, maybe it helps to shower in a chair, okay? So those are all like kind of things that I have advice for drains. Your drains a lot of times will have like a plastic dressing. If this is a drain, you'll have plastic on either side of it. It's like saran wrap. If it comes loose, don't tape it back on. Just leave the drain open to air, the area that goes into the skin. Don't retape it back down because you'll trap bacteria, okay? So that's that. No sex for 2 weeks because I don't want you to bleed, okay? There's no such thing as gentle sex, okay? It just ain't gonna happen. And then in that instructions for breast and body, there's other things in there, like it'll talk like, you know, you can expect, like if you had breast surgery, your belly is going to be swollen as if you're pregnant for 3 weeks. It doesn't mean you didn't poop enough. It doesn't mean you didn't, you drank too much water. It's just because you live on Earth. Surgery causes swelling and inflammation, okay? And it's just going to work its way down, okay? So if you had belly surgery, like a tummy tuck or liposuction, your genitals might be swollen. That's normal. Just give it 3 weeks, okay? That's normal. Remember that most of your swelling, bruising, soreness will be gone after about, 2 months, but like by about 2 weeks, you're gonna feel really good. For about 2 weeks, you're gonna feel a little bit lower energy. Obviously, don't drive when you're taking narcotic pain medications, or don't do things that your body can't take. Try to take enough time off from work and your responsibilities so you can have an enjoyable experience. I want you to have a good experience. So if you need help with that, please let me know. Also, the brain has two sides, okay? Some of us are right-handed, some of us are left-handed. I've got lots of people tell me, hey, my right breast hurts a lot, but my left one, like, I don't even feel it. Well, that's because maybe you feel this side more because that's the side your brain is paying attention to. As long as they look similar, I'm not worried about anything. Now, if one is like way out here and this one's over here and this one's the one that hurts, then yeah, maybe you bled, okay? But overall, more pain on one side doesn't mean anything. Also, people who get implants, they'll move their arm, they'll hear like a squishing sound, like a that's just air between the implant and the skin. It takes about 3 months for that to go away. Don't get freaked out when you hear noises and stuff like that, okay? So that's all normal. Now, for your medications, I'm gonna do one more video to talk about medications, but that's kind of like your post-operative routine. Also, massage. Don't worry about massage. I will tell you when to massage. You're gonna be too sore to massage right after surgery, and you don't even know how to do it. I will tell you what you need to do after your first post-op appointment, okay? Thank you again for the opportunity. I'm very strict about the protocol of my patients because I want them to do well, and also because I give a 5-year guarantee, right? If God forbid something doesn't heal well, I want to know all the variables, so it's important that you follow my directions, okay? Thank you very much. Have a good day.